I got new internet hoping it would help, and it's still problematic. So I appreciate your flexibility with me. I'll probably switch to phone here in just a moment, but want to take the time to welcome you all at this point to our Oregon Department of Human Services Self-Sufficiency Partners meeting. We do offer ASL and Spanish interpretation. To use the interpretation for Spanish interpretation, just go ahead and select that icon below, and you can select how you'd like to participate in our meeting. We also offer CART transcription services. The Self-Sufficiency Programs is committed to developing and deepening our partnerships to provide outstanding and culturally specific services and supports to the people in Oregon. This means listening and learning and working together across ODHS programs, state agencies with the 9 tribes of Oregon, community-based organizations, and members of Oregon's communities. This virtual meeting occurs monthly and is a forum for updates, discussion, feedback, and Q&A about self-sufficiency programs and other related subject matter. This meeting is recorded so that we can share the meeting along with the presentations and minutes to those partners who are unable to join us today. The follow-up email with all corresponding documents and links will be sent in 1 week. At this time, we do ask that you introduce yourself in chat. Please include your name, pronouns, organization, and role, as this is helpful to us and to partners for connection purposes. So I'm going to go ahead and do that myself here. Today's agenda includes information on the Survivor Investment Partnership Grant. And we're going to have a discussion around COFA eligibility and some outreach needs around that. Presenters, we do ask that you turn your cameras on while presenting where able, as our partners appreciate seeing the person who is speaking. Of course, we would also like to invite all those that are willing, able, and comfortable to show your cameras as well. Up first, we have Marcy from Survivor Investment Partnership to talk about a grant opportunity. Marcy, are you here?
I am. Good afternoon.
Awesome. Welcome.
Do I have the ability to share my screen?
You should.
Okay, I'm going to go ahead and let's see. Share screen. Okay, does everybody see a blue screen that has overview of Survivor Investment Partnership? Okay, so I am just doing a real quick update overview on the actual request for grant application. So Survivor Investment Partnership is a fairly new program within the ODHS domestic violent survivor programs. It is a general funded grant program, and we work with each of the 9 tribes of Oregon, 8 culturally responsive providers, grantees, and as well as our co-located advocacy agencies. We offer funds for them to use in their domestic violence and sexual assault services. The SIP program is intended to be offer autonomy on how each of the tribes and providers and agencies administer their program using SIP funds. It allows for offers services and financial support to survivors in a survivor-led and trauma-informed way. It's fairly new. It's our 2nd biennium. In the 1st biennium, we did a request for a grant application for 8 grants, and we awarded 8 grants. And unfortunately, one of them had to return funds and the agreement due to unforeseen circumstances. We were sad to see them go, but that opened the door for this opportunity right here that we are posting a new request for grant application for 1 grant. And as you can see on the PowerPoint, it's for the 23-25 biennium. And yes, we're halfway through. So we will work with that grantee to figure out how that they can best spend the funds down within either the biennium or with a potential extension, as we have done with the current providers in the previous biennium. So one grantee will be awarded $566,848 for that biennium, which they are able to use for direct services for survivors, staffing, administrative costs, which will be capped at 20%, and other costs, including, as it's travel, training, outreach, and infrastructure. We add infrastructure to the initial grant agreement because it's a lot of money, and some of the programs that we have awarded grants are fairly new to the domestic violence offering the services. So they needed additional infrastructure, whether it's remodeling their office to make it more welcoming to survivors that come in. They can purchase vehicles to help transport, not a lot of vehicles, maybe one, to help transport survivors out of the situation that they are in, or to take them to where they need to be. So that is just a quick overview of SIP, what the funds are for, and what we are doing. We currently have our FGA, request for grant application, posted to Oregon Buys through September 24th. And we just did a webinar for that RFGA, and it will be posted on the Oregon Buys link. And you can see the RFGA's number is listed. Sharon Landis is here from Oregon Department of Human Services, Office of Contracts and Procurements. She is our sole point of contact for any questions that anybody might have pertaining to this RFGA. If you were to reach out to us, we would refer you to Sharon, and if it's a question that she's unable to answer, then she'll loop us into that. So that is what I'm here for. Sharon, do you have anything to add to that?
I think you pretty well covered it. The application is part of the attachments on the FGA, and it's a very streamlined process. I think normally if you've done a solicitation through the state, you realize there's a lot of attachments. We really pared it down. We just have the one application that has two parts. It has the application part with questions, and then the certification part that needs to be signed. So it's really streamlined.
Thank you, Sharon. So unless there's any questions, I'm gonna quit sharing my screen and pass it back to Misha.
There is kind of a comment question in chat. I don't know if you have any information you can share, Marcy, or not, but about murdered and missing Indigenous women and children. If there's any anything you can share around that.
So we let's see. This is so many of our tribes. Many of the 9 tribes of Oregon are using some of their funds for that, for missing and murdered Indigenous women. They've got some pretty good marketing. I guess marketing might be the right term, but outreach about that. So yes, you're definitely able to use funds for that as well under the SIP grant.
Thanks, Marcy. Susan, is that what you were curious about? I don't know if Susan heard me or not, but that's okay. Any other questions for Marcy?
Susan, I don't know if there's anything else within, I don't know of anything within ODHS outside of what I mentioned. And then of course the tribes themselves.
Thanks, Marcy. Susan, I can look. I know that during the MMIW month, we do a lot of sharing of some information and resources around that. And I can take a look and see if there's something that's just not coming to mind right now, but that might showcase some of the different efforts that's happening around the state on that. So I'll take a look and see if I can find something. I appreciate you bringing it up. All right. Well, James, are you here? James is going to help lead us in a conversation.
I am, but
yeah, around COFA. Yes.
And just to introduce myself briefly, I'm James Barty, he, him. I'm the Engagement Strategies Manager with Oregon Eligibility Partnership. We're the ones who handle the one system for ODHS, doing the eligibility work. But it's my privilege to actually start this discussion off with Jackie Leong, who's on camera now. And I'll let you introduce yourself, Jackie.
Hi, everybody. My name is Jackie Leong. I'm the Director of the Micronesian Islander Community. It is a pleasure to be here and speak with you today. So my part of today's conversation is going to be talking a little bit about individuals who identify as Micronesian, or also from the Compact of Free Association, so COPA citizens. I think I have shared screen right, so hopefully it works. Yay! All right. So I have like about 6 or 7 slides to go over, and hopefully you all could hear me okay. It's kind of echoey in the area that I'm at right now. All right, so where is Micronesia? It's an island nation of Oceania. It's comprised of thousands of micro-sized islands, and there are 3 territories: the Northern Marianas Islands, Guam, and 5 nations, including the Republic of Palau, Republic of Marshall Islands, the Federated States of Micronesia, Kiribati, and Nauru. So for purposes of my presentation, we'll be focusing on, again, the COPA nations. And those are all 4 different regions, or actually 3 different regions: Republic of Palau, Republic of Marshall Islands, and the Federated States of Micronesia. And in the Federated States of Micronesia includes Chuuk, Koshrai, Pohnpei, and Yap. You can read up on more information about each of the islands by doing some independent research, but there's tons of different islands in each of those regions. So a little bit more, this is more about the history. So there was a lot of a history of colonization, first by the Spanish, then the German, and then the US. And then during the 1950s, there was an atrocity, nuclear testing that took place and subsequent nuclear fallout. And while this occurred primarily in the Marshall Islands, the fallout or the spread of the nuclear fallout was felt far and wide and continues to affect the Marshall Islands today. There also affects other regions too because of the military occupancy on the respective islands that I had previously mentioned, either the abandoned submarines, for example, the tanks and other military equipment that continues to be found either when it's dug up or when something starts to leak. The impact is still affecting their health significantly. There is a short video, I'm not playing it today, but it's something that folks could watch if you're interested, that talks more about the bombing that took place in the Marshall Islands. And health makes a difference because many Micronesians today are experiencing significant health issues with access to food, their local foods. And unfortunately, because of a combination of climate change and the rising water level, individuals are now losing the ability to grow food on their islands. There's also a substantial cost associated with health needs, and also an increase of diabetes, or better known as sugar disease, cancers, heart disease, and other chronic conditions. So so how the COPA Compact is supposed to work between the U.S. government and the respective island nations, individuals from those regions are supposed to be able to come here to the U.S. with just their passport and I-94, and they're able to go to work, go to school, own property. And in return, the U.S. has military occupancy on their islands, as well as supposed to be providing support for COPA Micronesians to ensure that they have health care, among other areas of care. But during the Welfare Reform Act of 1996, unfortunately, COPA Micronesians were classified as ineligible non-citizens. So over 20 plus years, they were unable to access personal safety net programs, including Medicaid, which is what they should have had, SNAP benefits, TANF, SSI benefits, and even student loans. So the end result, as you saw on the previous slide, significant neglect in healthcare access and the ability to be healthy and be well. Then there was a stimulus that was signed finally in December 2020, where Medicaid was restored as part of that 1,000 plus page document. And then the COPA Compact, or better known as CEFA 2.0, was signed earlier this year, or last year. And so now SNAP benefits, cash benefits, SSI, and other benefits have been restored as of earlier this year. And while these programs have now been restored, how the rollout has been in each respective state has varied. I feel that Oregon has moved farther along. We still have quite a bit of barriers for individuals who are eligible for Medicaid and also the other benefits, but we're working with OHA and DHS on ensuring that those individuals who are impacted get the care and the support that they need. This is just some contact information, so if folks want to reach out a little bit more about my organization or about MIC, my email, my work phone number, as well as our webpage. And that's all I have on my end. So kind of short, shortly.
Thank you, Jackie. Yeah, there's just asking her to give the context for these new policy changes that, as she mentioned, now this population, which the U.S. government recognizes we owe a debt to, is eligible for SNAP and TANF, and it took a little bit of time to work with our federal partners to ensure that that our eligibility systems and the one system can handle these new applications. So I'm happy to also share that we have some flyers that I hope those of you who work with this community, or even if you don't, just to be aware of, that these are available for you to take and use as you can. And I know it was a few weeks ago, we had a conversation with several advocates and other partners, like with OHA, about this new policy. And I just wanted to make sure that there wasn't any other questions. And one other little factoid I wanted to add is, we're talking about, according to the U.S. Government Accountability Office, we're talking about 4,300 people here in Oregon that meet these definitions. So we had a robust conversation last time. Maybe all your questions are answered now, but we have experts here in the room that can help with your questions on this. I guess this could be an easy topic, though, because we're for a little bit of time, co-citizens have been eligible for Oregon Health Plan, and earlier this year that we're eligible for child care assistance. I'm glad we finally get all the programs within the one system, allowed them to be eligible for SNAP and TANF as well. And I see, I'll just add, I'm vamping now at this point, but I'll add that since the TADVS, Temporary Assistance for Domestic Violence Survivors, is under TANF, that includes them, although, as they were telling me earlier, that really, case, if a case came to them, it would have made, it's sort of an academic point now, but COFA individuals would have been eligible in the past as well. But thankfully, it's an academic point. And I see a few other people, Christina or Jackie or anyone, if you have anything to add, that'd be great.
I think, hi, this is Christina with, and I don't know if
I think for
but I just wanted to add that also like the TADVS, sorry, there we go. Christina with the Oregon Health Authority Community Partner Outreach Program, but the TADVS, the Temporary Assistance for Domestic Violence, was also one of the programs that was part of that citizens of COFA nations now have access to. So I just wanted to add that one too, because I know that that one was the one that I wasn't aware of, and I think it's I just want to make sure people that know that is available to people that come from these Pacific Island nations.
May I add something, James?
Please, I was just going to call on you.
Yeah, good afternoon, everyone. My name is Brittany Zitzelberger, and I am a policy analyst for our Temporary Assistance for Domestic Violence Survivors program. And yes, it is true that these COFA changes do apply to our program. But to James's point, I just want to clarify that there's no, if somebody doesn't meet the federal definitions of being an eligible meeting citizenship, we can apply a waiver if they're experiencing domestic violence within our TADVS program. So citizenship for our program in general isn't something that we would be denying someone for unless they also don't have a domestic violence situation that meets our definition. So these folks should have been eligible. COFA individuals should have been eligible for benefits regardless of this change. It just sort of changes for us how we might fund those cases. But just want to be clear that yes, this absolutely includes TADVS, and that there's folks don't need to worry about needing citizenship for our program, because we can apply waivers to make sure they can get services.
Thank you, Brittany. Thank you, Christina. Jackie, were you going to add something?
I'm just going to emphasize that if folks have questions or need help with clients who need access to services, that MIC, American Founder Community, is one organization that is available to assist. We do have staff who speak several of the different dialects and are more than willing to meet with either different departments or individuals to talk more about the Micronesian COFA community.
Great, thank you.
Do we have any other thoughts or questions that we'd like to share? We really wanted to take time to make sure that if people have things that they really want to discuss or bring to the table, that there's time to do that with regards to this subject. So does anybody have anything you'd like to say? Anything else to share, or questions, clarifications you need?
Beth, you have your hand up.
Hi, everybody. I just, in answer to your question, Misha, I would love to hear from Jackie again in, I don't know, 3 or 4 months, because it's always hard when I'm so grateful that these programs have expanded to cover folks from COFA nations. But that isn't necessarily the end of the problem. Like, people have to know about it. People have to feel comfortable and welcomed to get, and understand the programs well enough. So I would just love to hear from Jackie again, if you don't mind, Jackie, about how it's going. Are people that from the FSM or any of the COFA nations, are they actually signing up? Are they finding barriers to signing up? Are they signing up and getting enrolled, but then they're getting confused in the system? Anything like that. I'd love to, I think that'd be a really great thing for this group to follow up on a little bit.
That would be great, and be happy to share even our experiences a few months down the line, because right now we are encountering individuals who are dealing specifically with issues with being denied for SNAP benefits and cash benefits. But folks like James has been really supportive in addressing those barriers for those individuals. And we're continuing to educate and provide information to our community about the ability to enroll and how to enroll, and connecting them with other agencies needed for the other services that they are eligible for.
Absolutely. If, Jackie brought a case to my attention, and, if there's cases where there's an issue, sometimes I can troubleshoot. I can't claim that solve every case, but that's, something like this where a COFA individual was denied access. It was just apparent that a mistake was made, and so we were able to clarify it. And Beth has a great resource as well. All right, Misha.
All right, thank you. Yes, we definitely, encourage anyone who feels like maybe there was an error, within eligibility, they feel like they should be eligible, that they ask questions about that, reach out to your local office, have somebody take a look at the case just to make sure there wasn't something inadvertently, in some sort of error in the process. So we are happy to take a look at those things for sure. So our discussion didn't take nearly as much time as we thought it might today, but that leaves some time for some roundtable. And I know there's a few folks that had some information to share. Jen Harris, I received a slide from one of the folks you just introduced me to about the survey. Would you like me to share that information, or would you like to share that information?
Sure, I can share a little bit of the information. I wasn't quite prepared for that today, but it is exciting information. So I didn't realize they had already sent through a slide. So if you'd like to pop that up, it would be great.
Sure, I can do that. Hold on, it's just a simple slide, but I will go ahead and share that so you can read through it here. All right, can you see it okay?
Right. Well, hi everyone. Sorry, I'm in the office today, so all my camera's in a weird spot, and I don't really want you guys looking at the side of my head. But I'm Jen Eras. I'm the lead policy analyst for the Child Care Assistance Program over at the Department of Early Learning and Care. And just wanted to give a quick update that we're going to have. It's called a Caseload Pulse Survey that we will be conducting this next month. Essentially, it's a very short survey. That's why it's called a Pulse Survey. It's a very short survey of families and individuals who have current ERDC benefits, but they're not connected to a provider. And so essentially we'll be gathering that information to see what the barriers are, what the situations are, and just get the family's response to why it is they're not actually using benefits. At this point in time, it's been a little over a year since the program stopped closing cases that were not connected to providers. So in that time frame, we have just about 4,000 families that are eligible for employment-related daycare benefits, but they're not using providers. We've done some outreach to families in the past to just try and kind of wrap our brains around and this issue that the families have. And we know that it varies. So we know that they're very well-known issues of either there not being care available in their area, or the care that is available doesn't match their need. In some phone surveys that we did a few years ago with families, there's also a lot of families that don't realize that license exempt family, friend, and neighbor providers can be approved to receive payment for child care. So, you know, this could be grandma, this could be next door neighbor, best friend. And it's not necessarily well known throughout all the families that they can actually use those individuals as their child care provider. We know that some of the resources aren't, the families don't know about resources. So like our child care resource and referral networks, they'll contract with them to actually help families through that listing process to become approved as child care providers. So not only licensed exempt, but they also are there to help our licensed providers to get approved to receive benefits so that they're ready and available when the families need them. But we're excited about this. It's always great to get that family voice and to be able to make an action plan around it. But really hoping to get some solid information from the families that we should be serving them, but we just can't get them connected to a provider for some reason. So I know that's been a concern among our program staff and our partners and the advocacy groups as well. So I wanted to let you guys know that we definitely hear that concern, and we're taking some steps to try to gather the information on what we do.
Thanks, Jen. Sorry to put you on the spot.
No problem.
Things are coming in during the meeting. Does anybody have any questions for Jen while she's here, or about the survey, or about employment-related daycare in general? This is a great time to do it.
Oh yes, and thank you for putting that in the chat. It is employment-related daycare, but also just a reminder that we do serve families who are currently on TANF benefits, or families who are attending school, teen parents as well. It's a friendly reminder that we do cover teen parents, and teen parents can actually apply for benefits apart from their parents if they are applying as the caretaker for the child. So I'm going to put those plugs out there.
I have a question.
Yeah.
I'm wondering, do you have any idea what some like potential solution or follow-ups are going to be from the survey responses that you get? I know we've heard of this problem a lot with families not being able to connect to providers, and we've also heard it from the provider side. There's also providers who have open spots, and they're struggling to find families to fill them, even when they do accept the RDC and have in marketing. So I'm just wondering what you've been thinking in terms of like the use of this survey and where you're going to go after you get responses.
That is really interesting that we have both problems. So we have providers that can't fill their slots, and we have families that can't find providers. I don't believe it's just a matter of matching those two groups up, because I think it really is the need that the family has probably doesn't match what providers are offering in their area. But we do plan to use some of the information to inform a parent guide that we're creating, hoping to have that available by January, I think is our tentative time frame. But we used to have a parent guide years and years ago. Essentially, it was really large. It was probably about 50 pages long. Families didn't find that useful. So we've done some surveying with partner organizations, and we're going to also do some surveys with provider and parent groups to have an informed idea of what type of information we need to have in this guide. But we do plan to keep it simple. Is one thing we've heard very loudly, is that it needs to be a simple guide. It needs to be something that's more evergreen, that doesn't need to be updated on a continual basis. So we're hoping that will have, definitely, we know it's going to have information for families about kind of the steps of, how to get childcare benefits, and then how to find a provider and how to get that provider connected, what it takes, some of our consumer education pieces about what childcare is available. And I think there's also some additional movements within licensing to be able to license some outdoor nature-based programs. So that's some work that's currently happening right now, which is really exciting. But yeah, we're really going to have to be what kind of data we can get from those pulse surveys. I'm hoping, and I would have to check with the folks that are running this, but I'm really hoping they'll have some regional information as well. As being someone who was a parent in a very rural area, I know it's so different, and the landscape is so different from when you're living in areas that might have more options available. So really hoping that we can see some regional feedback on that as well. I'm just touching on the chat, and at this point in time, so
Did
Jackie,
you see?
yeah. So there's a question on if we're accepting applications for the program, and we do continually accept applications for the program. There are bypasses to our waitlist, but the waitlist is still in place, and we do not have a foreseeable end to our waitlist. We haven't been able to invite any families off the wait list. In the last 2 months, we have finally started to see a little bit of a drop in our caseload. So essentially that wait list was put in place back on November 4th, 2023, and the caseload continued to increase up until July. So this last July, we did see a slight decrease. We saw another little decrease in August. Both of those were expected because we did expand eligibility quite a bit in July and August of last year. So we had a huge number of families that came on the program in July and August of last year, and we kind of expected there would be some that wouldn't renew their benefits when the 12-month certification came to an end. So as far as we don't have enough data to say that there's a downward trend yet. So we know we've had a drop for the last 2 months, but I don't anticipate that that's going to continue happening. We also know from our folks at DPU that we've had a lot of families calling in to switch their providers now that kids are back in school. So I imagine the number of families who are connected to a provider is going to shift pretty heavily this next month. But yeah, so at this point, we do continue to encourage families to apply because they may meet one of our bypasses to the wait list. But it's not open for everyone to apply and receive benefits. If they don't meet one of the bypasses that we have, then they wouldn't qualify.
Jen, can you remind the group what those are? I know we talked about it a while ago. But...
Yeah. So TANF recipients can bypass the wait list. As well as people who are reapplying for ERDC. So if they had benefits and it's been closed for less than 2 months, they can most definitely bypass the wait list. And we try to encourage families to get back in and get those recertifications in as soon as possible. Families who are eligible or have been found eligible for the Temporary Assistance to Domestic Violence Survivors grant are also eligible to bypass the wait list. We have just a few contracted childcare facilities across the state. So we contract with a few different Head Start agencies, and also hoping to include also our Baby Promise contract for bypassing the wait list. And then the other missing one. Which one am I missing? And our child welfare bypass. So essentially, if a family is working with child welfare, the child welfare worker can fill out a referral that essentially says that childcare is necessary to either keep the child in the family's home, return the child to the family's home, or place the child with a known adult. And if any of those situations are true, the child welfare worker can fill out that referral and send that through and ask them to bypass the wait list. But those are our 5 that we have at the moment. Yeah. Let's see, and there's a question in the chat. Is there any priority towards providing or mandating cultural awareness and cultural competency training for providers? That is not necessarily my area of expertise. I know with there are some cultural competencies within the quality rating and improvement system but I can't really speak to what's being mandated for licensed providers, but we can always get someone from child care licensing to come in and speak about some of those priorities and trainings that are required for our child care subsidy. So that the employment related daycare, the ones that receive payment, federally, the only mandated trainings tend to be around health and safety. So we have CPR and first aid, there's an introduction to child care health and safety, but none of the required trainings actually have to do with cultural awareness and cultural competency.
All right, thank you, Jen.
This has been great. Thank you, guys.
Any other questions? I know we have one more person who'd like to speak during our roundtable. I want to make sure they have time, but any last questions for Jen before we move to the next person? Okay, great. Connie Hunter, are you still here? I saw you comment earlier. Hopefully you are still here.
I sure am.
Awesome. Can you introduce yourself and the organization you're representing, and then go ahead and talk about what you had emailed me about? That would be great.
Okay, fantastic. Thank you, everybody. As you know, September is Suicide Prevention Month. Curry County created by ordinance our Suicide Awareness and Prevention Council to address the high rate of suicides among our youth, our seniors, and our veterans. I have been on the council since it was founded, serving in the seat of representation on behalf of our veterans, notably veterans, service members, and 2 generations of their family members living in Curry County. That equals very close to 50% of the population. We're kind of an anomaly. One of the activities that our council tries to do during September, Suicide Prevention Month, is to share information on what are the warning signs for a person who is at high risk for suicide. I've asked if Misha could share the information that I got from, this year, the Substance Abuse and Mental Health Services Administration made it easy. They provided infographics that are easy to print out. And I hope that you take the time to share among your colleagues, your peers, your family members, and certainly to other providers and partners. These infographics break out also for youth, a warning sign for youth. In our communities, everyone has a role to play in preventing suicide. For instance, faith-based communities can work to prevent suicide simply by helping people navigate the struggles of life. And local veterans serving organizations like the VFW or Vietnam Veterans of America can be instrumental in stealth mental health by providing support of peers. And why I mentioned faith-based and veterans community in the same information exchange here is because veterans are 8 times more likely to go to a clergy member before ever seeking mental or behavioral health support. I'm going to put a little bit of information in the chat about why faith-based organizations can be a trusted source of assistance for our veterans and family members. In addition to that, I encourage everybody to go to the VA website and look up moral injury support. Moral injury training is available, and I'll put a little bit about that, and I'll give the link to the moral injury support part of the VA website. Thank you, everybody, for being here today, and I always learn so much when I attend these meetings. Thank you.
Thanks, Connie. We appreciate you sharing all that information. And we'll be sure to include that in the follow-up, along with the infographics that you sent me earlier. So we've got about 5 minutes left. Does anybody else have anything they'd like to share? Or maybe questions that you'd like to see if we could address during today's meeting?
Yes, hello. Misha. It's Jay Greenfield with Punks with Purpose.
Hi.
Hi, I just wanted to share with any of the partners that are in Marion and Polk counties. We have an event coming up on Saturday called Punks in the Park. There'll be over 65 community partners attending. ODHS being the most prolific attendee of the group. SSP has 5 booths. But if you have youth between the ages of 11 and 18 in those counties, please be happy to send them our way. They get access to meals and supplies, pretty much whatever they can think of in terms of on a one-day basis. So if you have questions, please reach out to me. My email is in the chat, and I would love to connect with some of the other community partners that are in Marion and Polk County for other events we have upcoming in the next year or so. Thank you so much.
All right, thanks. If you wouldn't mind, can you resend me? I know you sent me flyers a while ago, but in case this one is different, that would be great, and I'll include it in the meeting follow-up.
Thank you. Yes, I'll be happy to do so.
Thank you. Anybody else have something they'd like to share with the group? All right. James, you had messaged me earlier. Was there something that you were hoping to share with the group? There's about 4 minutes.
Well, there's always stuff to share. Let's see. I'd love to make a plug for the One mobile app, Oregon One mobile app. You can find it on Android and Apple app stores. I even have a slide, so why not bring it up? Let's see. So, yeah, it's just allows people to have a little more control of their benefits. They can update their income. You know, you can apply through it, of course, but you can view any of the messages, any of the notices you have. You'll get them in one place. And find answers frequently asked questions, as you can see here. And there's new features of, where you can report a change, including verification of current food benefits. You can, be able to see these letters and update them. So it's a very handy little thing to have. When I have talked to individuals about it, they were surprised and happy that they had, one big deal thing is if they were seeking other benefits, this can, and maybe they're categorically eligible if they have SNAP. This is an easy way for them to show that they are indeed enrolled in SNAP to like a housing or some other early childhood place. So it offers that ease of proof. And just as a general update, since people are usually curious about such things, we are seeing our eligibility queue creep up. It's, these are numbers from last week, and, the average was 22 minutes. Again, you call early in the morning, the wait is less. It's not as bad as last fall, fortunately, but unfortunately, we're headed in that direction. So just something for you to be aware of. But that's the quick little bit I have.
All right, thanks, James. Anybody have any questions for James? So I know earlier this week, James hosted a one office hour where they're able to answer questions and things for folks. So I don't think the next one it's going to be how often do you offer those, James? It's going to be another month, or is it a couple months?
It'll probably be 3 months, but we are starting to get more recordings of, if you got 90 minutes and you want to learn more about the One system, there's a video of walking through a SNAP application on the One system. That's that's available. I don't have the link handy, but we can put it out with these notes. And so, for those of you, because the one, if you're not a medical assistant, it's a little bit of a black box. You got to be working with someone, looking over their shoulder as they're doing their application to learn about it. And so it's our effort to open up that box a bit, so people will know it's coming, and so you're better able to help people through whatever questions they might have. And then, of course, especially, obviously with SNAP, you have to, client has to go through interview anyway. But nonetheless, it's, you can flip through a paper application. You can't flip through the one system, but this gives you that opportunity to sort of take a peek at what some of those questions are.
Thanks, James. We'll let you know when the next office hour is so that you can take part in it as well. So I just wanted to throw that out there for you all. Well, we are at time. So thanks for being here today. And I'm glad we had a chance to do some roundtable stuff. It's good to just hear from everybody. And please do reach out to me. I'll put my email in the chat here shortly. If you have something that you'd like to share with the group, like we had a few folks share today, we'll make time for it. We might not be able to give you a whole 20-minute presentation time, but if we can, we will. Otherwise, we'll make sure that you can get your announcement out there, and we want there to be space for that because it's important as well. So thank you so much for being here, and we'll see you again next month. Have a great day.